And good evening, and welcome to this episode of the Your Health is Important Facebook Live broadcast. This is Dr. MJ Collier, your host, producer, and on-air personality. And we are live here coming to you from the offices of Atlanta West Primary Care. And we're here to answer your healthcare questions. Once again, I'd like to thank each and every one of you for joining us this evening because you have options, choices, and places you can be and things you can do. And we're just hoping to work together and form a partnership to optimize your health. So thank you once again for joining. And I want to make sure that we are hearing from some of our regular listeners. So let's start scrolling and then we'll give you a little quick monologue about what's going on. Okay. So good evening, Kathy London. So nice to see you, Kathy. We greatly appreciate you. And where are you calling or watching from? Mary Holmes, hi from Chicago. Chi-Town is in the house. Thank you, Mary. We appreciate you tuning in. Billy Sue, great to see you once again from Midlothian, Texas. Sarah Davis from St. Louis, Missouri, and she's in a different time zone. So is the Texas. So thank you for tuning in. Dr. Regina Fletcher's Robinson, thank you so much. We're great to hear from you from Atlanta. Miss Makiba Boland, thank you so much for being here, darling. You are wonderful and loved by all. Roderick Big Cheatham is in the house. Good afternoon, and thank you so much for being here as well. Nicole Anthony Shavers from Birmingham, Alabama. Thank you. We got Beham, Bright Light City in the house. Antoinette from Grayson, Georgia. Antoinette, is this your first time? So glad to hear from you as well, and we are so glad to have all of you turn in. Cynthia Day from North Kakalaki. We appreciate that. North Carolina's in the house. Kathy from Queens, New York. Kathy, great. We want Queens. We want New York. We want everything that's New York in the house. Willette Carter from Lakeland, Florida. Willette, thank you so much. Very good. I know you have tuned in before because I told you one of my high school sweethearts was named Willette. She was absolutely incredible. Appreciate that. Roger Big Chief, good afternoon from Orlando, Florida. We got Orlando. Houston's here. Shirley Williams Geary. Thank you, Shirley. We appreciate that. Chicky Williams from Fremont, California. Wow. Thank you so much. Nikki Motley. Cheryl Montgomery, Alabama. We are there. Arnita Juden from Mississippi. Mississippi. So great to have you here as well. Okay. Carmelita Silmore from California. Thank you so much. Carmelita, we thank you for tuning in. Orlando, it's so good to hear from you, my brother. All right. That is a great picture, too. Is that a new baby or is that your baby picture? Winnie King from Dallas, Texas. Thank you so much. Great to hear from you, Winnie. Joanne Brown. Hello, Joanne. Thank you for tuning in. Jeremy Mitchell from Shreveport, Louisiana. Shreveport is represented now. Mexico City. This might be a first. Trina Reed from Mexico City. Thank you so much. I hope you're enjoying that beach down there. Janae Allen from West Palm Beach, Florida, where all the money is ballers are. Raymond Lee Presley from Florence, South Carolina. Okay, Raymond Lee. We appreciate that. Joanne Brown from Alabama. Okay. Lisa Moore from Albany, Georgia. Thank you, Lisa. We appreciate you tuning in as well. And I hope that you all had an opportunity to listen to the broadcast this morning on the Ricky Smiley Morning Show. We were talking about the new guidelines for the COVID vaccine. Tashara Ireland from Douglasville. Thank you, Tashara. We appreciate you tuning in as well. Okay. CL Turner from Baton Rouge. Thank you so very much. We're going to do that. And okay, have to hold it for a second. Veronica Purcell. Hello, Veronica. Thank you for tuning in. Now, this morning on the broadcast, we talked about the new guidelines that were issued by the FDA on last Friday, and then endorsed and confirmed by the CDC on Saturday. That is coronavirus vaccine for young kids, coronavirus vaccine for children ages 6 months to 4.5 for the Moderna, 5 for the Pfizer. No, 4.5 for the Pfizer, 5 for the Moderna. Those doses are as follows, and this is what you need to know as a parent about which vaccine to get and why. The Pfizer vaccine is 10% of the adult dose and has to be given in 3 shots. It's 1 shot, then 21 days later you get a second shot, then 2 months after that you get a third shot. For a total of 3 shots, the regimen again is 10% of the adult dose. And so we have 3 doses that are there for the Pfizer, and it is again for ages 6 months to ages 4 and 1/2. The Moderna is 25% of the adult dose and given in 2 shots, 1 shot and then 28 days later a second shot. For both, they have already approved boosters for children that may be immune compromised, immune challenged, have problems with asthma or allergies, etc. So that would be a good opportunity to get your children vaccinated. So we are hoping that people will enthusiastically get these young people vaccinated. Understand this: the death rate in children, the infection rate in children is high now, but the death rate is very, very low. But if it's 1 out of 1 million people and it's your child, you would not want your child to die. And all of these deaths are easily preventable by having your child vaccinated. So very important that you do that. Get your children vaccinated. Right now, for the children down to age 5 up through adolescence, the vaccination rate is only 30%. And we really need to take advantage of that population. Now, I presume there's going to be a big surge in vaccine before the school year starts. Either the schools will mandate it or the people will ask for it because they don't want schools shut down. They don't want high absentee rates between the children or the teachers, because that will be what will happen if the children are not allowed to be vaccinated. So this is what we want to do. We want to make sure that the children are vaccinated, that you are vaccinated as well. Don't be the parent that's not vaccinated and your children are. That discordance in the house makes absolutely no logical sense. So if you've not been vaccinated, get your vaccine. Again, Dr. Collier, the pecking order that I recommend: the Moderna first, the Pfizer, then the Johnson & Johnson only if you absolutely have no other choices, or let's say, for instance, you are traveling and you got to get vaccinated and you need to be fully vaccinated before your cruise in 2 weeks. Well, the Johnson & Johnson will meet that criteria because you are considered fully vaccinated after 2 weeks after a single dose of the Johnson & Johnson. If you are, special populations like homeless people or people who might have difficulty getting back to the facility for the second shot, then the Johnson & Johnson may be good for a transient patient population. But other than that, the CDC they have not taken it off of the market. They're just not endorsing it as a primary vaccination at this point because of problems with clotting, blood clots, particularly a special and unique clot that happens in the brain that seems to be affiliated with that particular vaccine only. And the problem is that when you get blood clots, how do you treat them? You treat them with blood thinners, where the traditional therapy of a blood thinner for these clots makes the problem worse. So you have to make the quick diagnosis, figure out what's wrong, and treat them in a different way than you would normally. So that's where we are with the coronavirus vaccine. Let's get to Dr. Collier's personal story once again. I just came back from a medical conference where I had an opportunity to give 2 lectures to physicians from around the country. Very good. One of my topics was COVID. The other was Medicaid expansion. Well, this was in a very nice tropical atmosphere in Hilton Head, South Carolina, #1 golf destination in the world. And so I was concerned that because I would be eating and indulging in seafood probably every day, that I might gain weight while I was gone. Well, I was very shy about getting back on the scale. I returned back on Sunday, had Monday, which was Juneteenth holiday, out of the office to rest and relax, and woke up yesterday morning on Tuesday and said, okay, time to pay the piper and see if I actually gained weight. To my surprise, I actually lost a pound, even though I really indulged in seafood feasts. I had lobster, crab legs, seafood boils, oysters, and while eating those things, I had martinis, because I like to think martinis, if there's any hepatitis in the oysters, martinis will take care of it. So it was, from that perspective, breaking my limited calories that I was taking in an attempt to lose weight. So lost a pound, ate good, felt good, and that was great. And so since I've been back, I've been back on my intermittent fasting, only eating anything I'm going to eat between 10 a.m. and 6 p.m. That can be 8 to 4, it can be 10 to 6, it can be 12 to 8. And I will vary depending upon what day of the week it is. But while I was gone, I made sure that I had my Lipodrops Maximum formula. So I took the Lipodrops to the event with me. Here we go. Let me see if I can get that in there. It's not showing up. There we go. I had the Lipodrops formulation, 1 dropper full before each meal, held under the tongue for 2 minutes and then swallowed. I also had the ketomax formulation. The ketomax is absolutely incredible because it helps you burn fat. It gives you a state of ketosis as if you were on a keto, a South Beach, or the keto diet. So that is amazing. And so one in the morning, one in the evening, the Lipodrops before meals. Probiotics to keep my stomach and the bacterial flora great, particularly if you're indulging in a lot of raw seafood or any raw foods for that matter, like sushi, etc. Probiotics, God's gift, once again, to the GI tract, to allergies, asthma, and all these other issues that are going on. So this has been an incredible journey. Again, as you can see, my collar is loose, and this is a smaller shirt that is slim fit design. Dr. Collier had not had issues, not had the opportunity to do new clothes for a while. So once we were able to do that, we found out that it actually worked relatively well. We have indulged in some wardrobe changes and still on this weight loss journey. So I am at the goal weight. I wanted to be 30 pounds. I wanted to be 20 pounds down, actually. I got to 20, then I said 25, then I pushed it to 30. So at 30 pounds down now, I'm trying to maintain, and I've been successful at doing so up to this point. This weight loss journey started in late January. And has continued now. Now we're toward the middle / end of June, and so we're 6 months in for all practical purposes. And so this has been 5 months, 6 months in. It's been great. It's been wonderful. And if you'd like to join me successfully dropping that weight, then go to the website, lipodrops.com, lipodrops.com. You see it scrolling at the bottom. Find out how you too can join this weight loss journey. So, okay, this is the People Show. We are into it now. So it's time to ask and answer your healthcare questions. Let's get to it, Habit. What can I take to boost my energy? Well, Winnie, energy and fatigue is a complicated issue. Oftentimes, the thing is that we're doing too much. We're not getting enough rest so that our body can recuperate. When you're sleeping, your body goes through a cycle of rest, restoration, and rest and restoring. So when doing that, you have to make sure that you're getting enough sleep. Sleep, the number one way to obtain that. The problem is the universally, most of us stay up to 11 o'clock or midnight. The universal wake up time for working people is around 6 a.m. So you're already limited to a minimum of 6 hours of sleep. And that's provided you get an excellent 6 hours of sleep. In the sleep cycle, there's a cycle of which there are various stages. In that stage, the stage that allows you to rest and restore is REM sleep, REM, rapid eye movement sleep. Well, it takes 2 hours to get into REM sleep, and that's when you know you're in REM sleep when you're dreaming. It takes 2 hours to do that. If you wake up, go to the bathroom, if your phone goes off, anything that distracts you, then that clock starts. From the moment you get up, the clock restarts again. So it's going to be 2 hours before you get back to REM sleep. So if you're lucky, you get the REM sleep in 2 hours. Now you got 4 hours of actual sleep that you can get. And so you're getting half the amount of sleep that you really need to get. We need to get 8 hours. Nobody gets 8 hours. I clearly understand this is a problem, but a minimum of 6 would be ideal. If you could get 6 hours, you'd be good. But that may require you to change your lifestyle somewhat. About a year ago, I made a conscientious decision. I was not going to stay up to midnight every night, mindlessly watching television. I just take those things that I want and watch them the next evening when nothing else is on after the news. Or I binge on the weekends. But I try to be in bed no later than 11 o'clock. On work nights, so to speak, and then try to go to sleep at least by then and not wait till midnight. And then my first radio broadcast is at 6:45 a.m. Eastern Standard Time. So I have to be up at 6, wash my face, brush my teeth, get ready for the broadcast, and I do that within 45 minutes. So that is a regimen that I found gives you more rest, relaxation. Other things, you might want to take some vitamin supplements to boost your energy. Have your B12 level checked, and even if it is normal, B12 supplementation will give you energy. One of the things that's in the Lipodrops is vitamin B12, so you can get it from the Lipodrops and lose weight too. You can also get sublingual B12. That's B12 that goes under your tongue. There are drops, there are tablets that will melt under your tongue, and they are very effective as if you were getting B12 injections. And then if it's really a problem, you're really feeling fatigued, then you need to check your thyroid function as well. But a lack of sleep, number one cause of fatigue. Then vitamin deficiencies, then thyroid issues, and then of course anemia. Anemia is the most common from the blood perspective. Particularly in women of childbearing age, if you're still having menstrual cycles, you are anemic. So you need to take a vitamin with iron. One that I recommend would be one a day for women. There are others, Centrum, Z-Bec, a complete multiple vitamin with iron and minerals that has everything in it that you need so that your blood count is where it should be to give you the gas in your engine. All right, next question. Shantae Washington Anthony. How long after having COVID can you be vaccinated? The original guideline was 3 months after an infection. Then they lowered that down to 1 month. And so there are even people, and I tell people there's no real contraindication to getting vaccinated 2 weeks after you've recuperated. But if you would like, I would give my body time for the natural immunity to kick in from having had the infection. So that would take about 2 to 4 weeks. So I would say ideally a month before you can get your vaccine again. It doesn't matter whether you're vaccine naive, never had the vaccine, or whether you've had a couple of shots and it's just time to get a booster. Any of that will work for you. If you're getting a shot, if you're vaccine naive, get the Moderna vaccine. If you got shots before with anything other than the Moderna, get your boosters with the Moderna vaccine. If you got the Johnson & Johnson single shot and you need a booster now, nobody's recommending a second Johnson & Johnson injection. Either you get a Pfizer booster or a Moderna booster. One thing I would not recommend, if you got a Moderna shot, you do not get a Pfizer booster. That is just not good science, and that is illogical. So the pecking order, vaccines preferred, Moderna, number one, the Pfizer, number 1.0, number A, 1A, and the Johnson & Johnson under the circumstances that we described earlier, i.e. you need to be vaccinated in 2 weeks or less, or you're transient and can only get one shot. That means it's better than nothing. Again, but if you're a woman of childbearing age, I would be concerned about the potential for clots, and also adolescents, the potential for clots as well, and myocarditis, the inflammation of the heart. Okay, great question. Antoine Oxford, what is the medicine you were about on the radio that would help you lose weight and lower blood pressure? Okay, helps you lose weight. The weight loss helps you lower the blood pressure. There's no combination that does both of those things. But what I was talking about was the class of drugs called GLP-1 inhibitors, and they are the most one that everybody knows about. It's particularly for people with diabetes. It's indicated for the treatment of diabetes, but its side effect is that it makes you lose weight. That's called Ozempic. You have heard the commercials. Ozempic. If you watch any basketball game, football game, etc., any sports, even golf, they talk about Ozempic as a treatment for diabetes. But again, the primary use almost now is for weight loss. Now, there's the same exact drug that is sold in different doses called Wegovy, Wegovy, Wegovy. Both of these are once a week injections that you take that decrease your appetite, increase your metabolism, make you lose weight in an amazing fashion. Now, there's a brand new product that literally just became available. It is a combination product. It is also a once a week injectable, and I'll be talking to you more about that one as well. But it's only indication right now is for diabetics. But if you are pre-diabetic, which a lot of people are that are overweight, you might be able to get it. And of course, you can find all of these are prescription drugs. So if you find a doctor who can prescribe it, you can always pay for it. But don't be, you'll get sticker shock. It's over $1,000 for a 1 month supply. But again, work phenomenally, work in everybody. And that product is going to be one that we're going to talk about. Okay, great question, Antoine. Arnita Justin, is calcium citrate vitamins good for your joints and the knees? Okay, the calcium citrate, citrate is citric acid, basically orange, or like a citrus fruit that makes calcium easier to absorb into your body. So it gets into your serum now, and calcium is a key component of bones and teeth. You can actually get too much calcium. That's not difficult. It's difficult to do rather. But you can get too much calcium and cause yourself to get gallstones and kidney stones. But for the vast majority of regular people who will metabolize the calcium just fine, then you shouldn't have any issues with that. I think that calcium citrate is good. They have several formulations you can take from 2 to 4 capsules a day. There's Caltrate with D, with vitamin D in it as well, which is the ultimate combination. So things that you can take, but they do help with joints all over, not just your knees. Your knees are just where you primarily manifest pain from arthritis. Your knees, then your hips. Those are the areas that you're going to have major issues with from osteoarthritis, which is degenerative joint disease or a function of aging. So keep those joints strong. And that is why when women go to get the bone density test, and men can as well, but it's usually a test that women get that determines whether you need calcium supplementation. But it's not a problem. Just take routine supplements just to keep your bones instead of waiting till your bones are soft and weak and easily breakable. This will help tremendously in doing so. Okay, Anita, thank you so much. Nicole Anthony Shavers, can I take the ketomax while on metformin? Yes, you can. The ketomax is perfectly compatible with the diabetes disease state, and the weight loss will help you control your blood sugars even better. So the two things work symbiotically. Metformin is the #1 most prescribed drug for the treatment of diabetes. It's #1 in the world. And here in the South, we have a drugstore called Publix. Publix literally gives metformin away. A prescription of metformin costs you absolutely nothing. It comes in 500 and 1,000 milligram tablets. It is actually 250 as well, but nobody uses that. 500 to 1,000 milligram tablets. And in those tablets, you'll take up to 4 a day, up to 2,000 milligrams. This is a therapeutic dose. In Germany, there's a treatment protocol for the disease state diabetes where you take your metformin only 500 milligrams with each meal, breakfast, lunch, and dinner. And what you find out is that this is a very effective way to control diabetes. You lose weight, and your hemoglobin A1C lowers. And again, you can obtain this at absolutely no cost at some places, but even other places it's very inexpensive. So metformin. So if your doctor recommends metformin, then you can take it with enthusiasm. Also, ageless or aging centers, places that treat and try to keep you young, they use metformin because it has a side effect, if you will. It makes cells age slower. It slows down a process called apoptosis, which is where cells age and die. So a lot of people use this in health centers where they're trying to keep you healthy and young. So one of those things that you can take it as well. So metformin, also known as glucophage. Glucophage is one of the name brands that became popular. It's kind of like Tylenol and acetaminophen. Acetaminophen is the generic name. Tylenol is the most common brand name. Glucophage is the most common brand name, but now metformin. Okay. What can a person do that has stage 3 or level C of congestive heart failure do to prolong their lives and better manage their health? Okay, Ernest, with congestive heart failure, you got to be very good partners with your cardiologist as well as your primary care doctor, because congestive heart failure is a process that if you don't take care of it, even though you're feeling great, you can greatly reduce your life expectancy. And what that means is that your heart is not pumping efficiently enough to move blood, 1, out of your lungs, or 2, around your body. So no blood is not getting to your distal areas. It's not getting to the your feet, your hands, those sorts of areas. So that is a big problem. So when doing so, we want to make sure that you are your heart is pumping and circulating quite well. So in doing that, to make sure that your heart is circulating, you want to keep the fluid level at a controlled amount. That means no fluid overloads. That's why diuretics such as Lasix and hydrochlorothiazide are primary therapy, and then drugs that will help your heart pump more efficiently. So your heart is pumping like this and not in a way like this. You want it to pump easily, and so that is called, you want to make sure that your heart has an effective ejection fraction. You want that ejection fraction to be 50 to 55%. That's ideal. With congestive heart failure, that starts to decrease. That means the heart is pumping, but it's not pumping blood out of your heart. So the right side of your heart pumps blood to the lungs. The left side of your heart pumps blood to the body. And you can have failure on either side or on both sides. Either way, it can create a major issue as far as your oxygenation of your tissues is concerned. So again, you got to be very good. You want to keep your weight down. You monitor your congestive heart failure by weighing yourself on a daily basis. If you find that you've gained 3 pounds overnight, then that's probably fluid retention. That means your heart is not pumping and you need to more aggressively diurese. So very important that you stay on top of this. Don't become complacent. It is a process that it's not hard, but it's continuous. You have to do it every day. You have to be conscientious about your salt intake. You have to be conscientious about taking your blood pressure medications on a daily basis. All right, great question, Ernest. How do I treat tinea versicolor on my back naturally? Okay, tinea versicolor is a fungal infection. Some people call it acid. In the South, they call it acid. It has nothing to do with tomatoes, Coca-Cola, or any foods that you eat for that matter. It is a fungal infection of the skin. And that is tinea means is a fungus, and versicolor is the type of fungal infection that's on the skin. It usually infects the back of men. It can infect the face. It gives you a patchwork look where you have light spots and dark spots. It can either make spots dark or light. It can go either way. So when doing that, you want to make sure that you treat it. So antifungals are good. One of the things that I recommend to patients is you can take a bath using like Selsun Blue, which has selenium in it. Selenium is a good product that will kill the fungus. You basically bathe with an antibacterial soap such as Dial, the White Bar, or Libra 2000. Wash that, get a good soap going, clean, remove dirt and debris from your back. And it's difficult to do. You might have to get somebody who loves you to do it. Washing back is one of the benefits of having a good partner, particularly if you got two shower heads in your shower. But if you only have one, you just take turns, but you watch each other's back, because men in particular, we cannot do it. If you don't have a willing partner, get you a back brush that's got good bristles on it. You put a good amount of soap on there and then wash it. You rinse it, then you apply the shampoo, Selsun Blue, or any shampoo product with selenium in it. You let the lather stay on the skin for an extended period of time, then rinse it off. You can do that daily. Now understand, when you first kill the fungus, the skin will be whiter and it will show up more contrasting, so it will be more brilliant. And you will see, they say, oh my God, what did that quack Dr. Collier tell me to do? Well, over time, in about 2 weeks, it will blend back in, it will repigment, and you won't be able to tell it was there. The only variable will be if you get sun exposure to the surrounding skin. The fungoid skin will not tan because it has no pigment capability. Once it has renewed pigment capability, it will tan and then it will blend back in. So you want to stay out of the sun while you're in treatment. So no trips to the beach. If you do, you want to make sure that you're wearing a cover that covers that sunproof and it shields you from, and they have t-shirts that do that now, not just sunscreen. You want to cover this up, because if you have this problem and you tan, you're going to tan the areas of skin around the fungus, not the fungus skin. And so it's going to be darker. The fungus is going to be light. It's going to show up more dramatically. So it's easy enough to treat. There are pharmaceutical products that can do it as well. There are tablets that you can take for 1 week, 2 weeks, or a month, depending upon the degree of infection, that will clear it up. The great thing about those is that they will give you a natural antifungal barrier under your skin that will last for an extended period of time and make you unsusceptible to the infection. Number one cause of this, sweaty back. You go somewhere, you work out, you put on a t-shirt, or you got a wet t-shirt on while you're driving home to take a shower instead of showering and changing clothes at the gym. That wet t-shirt predisposes you to getting a fungal infection. Same mechanism for jock itch. Same problem, different fungus, but still a fungus, and you would treat it roughly the same way. Great question, Raymond Lee. Okay, Sandra Pope Lamar, how long will it take to lose 40 pounds in a healthy way? Well, weight loss is three things. Number one, how much you want to lose. Number two, how quickly you'd like to lose it. Number three, how much you're willing to spend to accomplish your objective. Now, understand this. You can limit your calorie intake, go to intermittent fasting, drink more water every day, and you will lose weight. Your weight loss then will be 1 to 2 pounds per week. So that will be, let's round it up to ideally 5 pounds. Okay, so you take, you want to lose 40 pounds, 5 times 8 is 40, take you 8 months. You can speed that process up. There are supplements such as the Lipodrops Max, the ketomax, that will help your metabolism increase and help you burn and lose more weight faster. So it just depends on your objectives. But again, the way to lose the weight is not limiting your calories, because if you do that, as soon as you stop that process, if you lose 20 pounds, you'll gain back 20, possibly 30. And so that is what the issue is. Every calorie limited weight loss program, and those are what I call the strip mall diets. That's quick weight loss, Weight Watchers, all of these diets that you hear about and you see advertised. They, each and every one of them works if you do what they tell you to do, exactly the way they tell you to do it. You will lose weight. You don't even have to buy the food that they sell, other supplements. You will lose weight just following the guidelines. The problem is, once you have finished and completed the diet program, if you stop doing that, you'll gain the weight back. And so that is the problem. That is the problem. So ideally, you want to lose weight by altering your metabolism, which gives you a permanent solution to being overweight, and so that you will maintain a good and normal weight, a healthy weight, if you will. Okay, great question. It's been over 1 year since I was hospitalized with COVID real bad. I'm still fighting fatigue. What do you suggest? So you have long COVID symptoms, and that fatigue is just one of them. You probably got other symptoms too. People still reporting ringing in the ears, a tinnitus type of problem. People reporting, again, loss of taste and smell senses, or altered taste and smell senses. But again, fatigue, number one, people just can't get through a work day. They're having it, if they're back at work at all, they're having to work short days, half days, limited schedule, 2 to 3 days a week versus 5 days a week. The problem with long COVID is inflammation. How do you treat inflammation? With anti-inflammatories. Your natural anti-inflammatories to help with this, we have them in our armamentarium. Vitamin D3 at a dose of 5,000 international units per day. Our Doctor's D product is ideal for that. You can get it anywhere, however, but 5,000 international units. Go to lipodrops.com. Omega-3 fish oil is also good for inflammation throughout the body, helps prevent heart attacks and strokes as well. So also probiotics. Probiotics have a general anti-inflammatory function in your immune system and your GI tract. So there are other benefits that we don't know the mechanism of, but it helps with all those inflammatory disease states. There's no pill, there's no test, there's nothing you can go to the doctor and he writes you a prescription for that's going to give you benefit to long COVID to this date. We don't have an answer for that. Some people with COVID symptoms who have not been vaccinated, they get vaccinated and their symptoms resolve in a very short period of time, 1 to 2 weeks. So that is a benefit of taking the shots. If you've already had the shots and you haven't had a booster, you also might get that benefit as well. But again, you can't go wrong with the natural anti-inflammatories, vitamin D, omega-3 fish oil, and then throwing in a little probiotics as well. Other natural things you can do that boost your immune system and help with inflammation: turmeric, curcumin are good natural anti-inflammatories. There are others, but again, the vitamin D, number one recommended, omega-3 fish oil as well. The great thing about omega-3 fish oil is you want a product that is pure and has been purified of all the contaminants, because they literally get fish oil by basically taking the fish and putting it in a blender and taking all the oil from it. Well, if they don't purify it, anything that fish is eaten or taken in is also ground up and in that fish oil. And the best fish oil comes from bottom feeders. So bottom feeding fish that eat anything that has sank to the bottom of the lake, the ocean, or whatever, they eat it, and it's a lot of garbage, it's a lot of pollution, it's a lot of things like that. You have to remove that from the oil. So if your fish oil capsule is cloudy, then it has not been purified. If your fish oil capsule smells fishy, then it has not been purified. So our Lipo Omega fish oil product, crystal clear. You open the bottle, there's no pushback. You will not get the smell of fish from that. You look through the capsule, you will see it's crystal clear and pure. So you want a product that's like that has been ultra purified and ultra centrifuged and purified to make sure that all contaminants have been removed from it. Go to lipodrops.com and see what we have to offer you. Okay. Janae Allen, my cardiologist, has requested me to get a myocardial perfusion imaging test next month. Should I be worried? Okay, that myocardial perfusion imaging test is going to do two things. It's going to check basically your ejection fraction to see how well your heart is pumping. It would also determine how the blood flow in your heart, all the tissues of your heart being perfused. Is your heart. Your heart only has two arteries. It's got a left and a right. The left main branches into two smaller branches, and that's it. So you basically only have one artery that's providing blood to the left side of the heart, and one artery that's providing blood to the right side of the heart. If the right side is compromised, blocked, obstructed, you get no blood flow from that area. That is what we call a minor heart attack. Most people can survive that. Even if the right side of the heart is not functioning, blood will passively move through the right side of the heart, get to the lungs, be oxygenated, come back to the left side of the heart. If the left side, however, goes out, particularly if it's the left main artery, that's called a widowmaker. That's when you have a major heart attack. Most people do not survive. If you get one in one of the distal branches of the heart, then you're going to lose that function of that part of the heart. It's going to scar down. It'll be strong tensile wise, but it'll be a loose area where pumping is not happening effectively. So when that happens, blood, instead of flowing in a straight line, that's called laminar flow, you will get turbulent flow. Turbulent flow will result in blood clotting, and you get little microscopic clots that can go to other parts of your heart or can go to your brain and cause a stroke. So yes, a very important test. I wouldn't be worried about it because it is what it is. The point is, depending upon what the cardiologist finds with this test, then you should be fine. The mere fact that it's being scheduled and not done on an emergency basis means that your heart is probably going to be okay and you're going to get a clean bill of health. But again, follow up, make sure that you get not just that test, but other tests I recommend, a stress test and an echocardiogram, possibly even a calcium score to see how well your heart is functioning. So calcium score test, very easy to do, walk in, walk out, no prep required. Stress test can either be you get on the treadmill just like you've seen on television, you run on the treadmill under what's called the Bruce, BRUCE protocol. And what that is just a timed period that you walk/run until your heart rate gets elevated, and they keep elevating the stress level as you go through the protocol. Some people can't tolerate that. They can't walk fast enough to be on the treadmill. They can't support their body weight. So they can literally give you a chemical that will do the same thing. It stresses your heart, makes your heart rate increase, and then you go from that perspective. So there's a medicinal, a pharmacological stress test, and then there's the actual stress test when you get on the treadmill. And then there are a few other more invasive tests, a cardiac catheterization, where they literally go through a vein in your leg, go to your heart, and then they attach a catheter to each branch of the heart blood. So the left side and the right side, they shoot a little dye down there and they see how well the blood is flowing through the heart. So that's where we are with that, Janae. I'm sorry. It goes into an artery, not a vein. It goes to an artery, goes back to your heart, and that's how they determine how well your heart is functioning. So thank you. Cynthia Benson, what causes swollen ankle muscles, spasms at night, and pain on the bottom of your feet? When I drink the liver cleanse tea, it seems to ease off. Okay, seems like you have found a solution, the liver cleanse tea, if that seems to help with it. Muscle spasms, swollen ankles could be a variety of things. You might need to be detoxed. You might need to have your blood pressure checked, monitor your sodium intake, even your sleep posture. Some people that sleep on one side or the other, most of the time you sleep on your side, you get discomfort, you switch to the other side trying to find comfort. So what you basically do is compromise the circulation in both legs overnight, and you have swollen ankles. Your ankles may recuperate overnight. You wake up in the morning, your ankles are fine. But as the day goes on and gravity decreases the amount of fluid return from your legs to your heart, and your ankles start to swell. Particularly if you got a sit-down job. If you're sitting at a desk all day, then it's just a problem that you're going to have to deal with. So one, if you're sitting, get up and move. Make sure that at a minimum of every 2 hours, you get up, walk down the hall, take a few laps around the desk, whatever it takes, because the walking motion helps move fluid from your legs back to your central body where your heart will have your kidneys filtered out and you have to urinate that excess fluid out. Make sure you're drinking things like water when you're sitting. That will also make you urinate more, but it also is a pure way to keep your liver and your kidneys functioning quite well. So there we go. The liver cleanse tea, something that seems to be helping as well, but I would check out other possibilities as well. Can I take lipo while taking the nastrazol? Yes, you can. Any of the lipo products perfectly compatible with the nastrazol. As a matter of fact, that will help you decrease your body fat while increasing your muscle mass. So great opportunity to combine two things and accomplish your objective. Once again, increase muscle mass, decrease body fat, weight loss. That will do it. CL Turner, how do you feel about Trulicity versus Singularity? Trulicity is an injectable product, and Singularity is a combination of a Jardiance and a DDP4 inhibitor. It's not either or. You can actually take both of them and get an even greater response when doing so. If you have difficulty with injections, then Trulicity is an injectable. It's once a week, but it's still an injectable. It's not unpleasant when you get it. So one of the ways to do, but the Singularity you take is an oral that you take on a daily basis versus Trulicity. Both very effective, but in Dr. Collier's treatment regimen, I will oftentimes use a combination like this, basically a SGLT2 inhibitor, which is the Jardiance, the DDP4 inhibitor, as well as the Trulicity, which is a GLP-1. That is the ultimate combination. It literally addresses every defect that a person with diabetes has. So it's not like you're curing the diabetes, but you're controlling the symptoms. But the new product that I'm talking about is made by the same people who make Trulicity. It's a combination GLP-1 and I can't remember what the other product is now, but it's two things in one injection, and it is absolutely incredible in what you're going to do, because it lowers your blood sugar dramatically, decreases your A1C more than 1 point. Most drugs, oral, injectable, or whatever the baseline is, it will decrease your hemoglobin A1C or A1C level by 1 point. This does it by 2 or more points and dramatic weight loss. Some of the other injectables, say 7 to 10 pounds. This has been showing 20 to 30 pounds just from taking the injection once a week. You're going to see some great things. Tune in next show in 2 weeks. You will hear great things about this new product out. I'm going to base the entire show on it because everybody wants this information. Last week, I was diagnosed with ulcerative colitis. Can you give me some information about it? I'm so lost with this. Is this curable or treatable? How do I manage it? Curable, no. Controllable, yes. Treatable, definitely. Colitis, one of the great things about that would be you need to take some probiotics to stabilize your gut. I also would obtain food allergy testing. Now, colitis is a diagnosis that's usually made with not just looking through a colonoscope, but also getting a biopsy. It shows inflammation of the lining of the colon. It can be any of the intestines, but the most common thing is for the colon itself. It can be in one part of the colon or throughout the entire colon. So it's an inflammatory process. In some cases, it's an autoimmune process like lupus or rheumatoid arthritis. So they're actually using a product that was originally made for rheumatoid arthritis, Humira, as an injectable, that will control the symptoms for colitis. But simple things you can do right now. Probiotics have been shown to have phenomenal improvement with this. You also will have to be concerned about the foods that you eat, things that will irritate, aggravate, and antagonize the lining of the intestines. So you want to make sure that you'll find out what that is. It could be a spicy food. It could be something you think is healthy. It can be a fruit. It can be a vegetable. Any of that bothers you. But the most significant symptoms, moderate to severe crampy abdominal pain, diarrhea that sometimes can be bloody and uncontrollable. So you have to calm that colon down. There are medications that you can take that are oral. There are medications that you can give yourself rectally. It's a whole gamut of treatment and all of that. But the simple thing you can do right here today, start taking probiotics or start eating a cup of Greek style yogurt or Activia brand yogurt. Activia comes in a little green cup. You see it all the time, but any yogurt that says Greek style, it has the highest concentration of probiotics in it. And you can either eat the yogurt every day or take the pills or the capsules. I take the lipobiotic every morning. When I brush my teeth, I take the lipobiotic. When I go to bed at night, when I brush my teeth, I take the lipobiotic. You can take 2 at one time. Some people take up to 4 a day. I found that 2 works ideally. The thing about a probiotic is this: you want to have a probiotic that has multiple cultures in it, and the unit of measure for a culture in a probiotic is CFUs, or colony forming units. You want that number to be in the billions with a B, not the millions with an M. Billions with a B. You want more than one colony. And so I say the minimum would be 3. We have the lipobiotic product has more than that. each colony is in the colony forming units of billions. And so you will actually get great benefit for as far as your GI health is concerned. So start taking the probiotics. You can start that immediately. You don't need another diagnostic test. You don't need anything else because colitis or not, the probiotics will help tremendously. Go to lipodrops.com and get yours today. Can you explain the dosage of vitamin D? In the past, I was told not to take over 1,000, but Lipodrops is at 5,000. Okay, not the Lipodrops, the Doctor's D is the product that has 5,000 international units. 1,000 international units is a sub-therapeutic dose. That will get your vitamin D in the low side of normal range, possibly in conjunction with sunlight exposure. That was an early recommendation. We have learned a lot about vitamin D at this point, and you want it to be vitamin D3. It comes in vitamin D2, which is the inactive form that has to be converted to vitamin D3. Some people's bodies do that very efficiently and effectively. Some people don't do it efficiently, but they do it over time. Others don't do it well at all. So the simple solution to that is don't take D2, take D3. That way you already have the active component and you are ready. But what we have found out, again, normal range for the vitamin D level is 30 to 90. Taking 1,000, you'd be lucky to get to 30. You want to be between 60 and 90. At that point, you have optimized your immune system function. And there are hundreds of clinical trials and studies that show that vitamin D levels of 60 or greater protect you from viral infections such as influenza A and B, bacterial infections such as strep throat and pneumonia, viral infections such as the Omicron variant of the COVID virus. So the Delta variant, the Omicron, all of them. You can have great benefit boosting your immune system with vitamin D, but also it protects and prevents you from getting certain cancers, pancreatic cancer, colon cancer, breast cancer in women, prostate cancer in men, multiple clinical trials and scientific studies that have shown the benefit from as far as cancer prevention is concerned. If you are diagnosed with cancer, the first thing that your cancer doctor is going to do is put you on vitamin D as a supplement. And if they're not putting you on 5,000 international units, you're getting a subtherapeutic dose. So 5,000 international units will get you in the range that you need to be in. So no contraindication to that. I know that that's what you were told in the past. That's when healthcare providers didn't know any better. We've learned, and now we know that the optimal dose is 5,000 international units on a daily basis. Great question, Deborah. Okay. What do I know about POTS syndrome? I do not, Andrew. You have stumped the doctor. POTS syndrome is something I have no clinical knowledge about. So you're going to make me Google it, and I'll talk about it next time we have a show. Okay, Tamika Evans, do you recommend going vegan to lose weight, lower your A1C, and high blood pressure? Tamika, I have a lot of vegans that are overweight and have diabetes. So it's not necessarily that you're only going vegan. It's what you eat. There are vegans that are overweight. So it's amazing. I didn't think it was possible, but I have patients that are strict vegans that they went vegan to lose weight and to improve their health. And they actually have had some improvement in their health, but they're still overweight. And the impact on the A1C, there are a lot of vegan foods that can impact your diabetes in a negative way. Same thing with juicing. People say, well, I'm juicing. A lot of your fruit juices are high in fructose corn syrup, so they can make your sugar go sky high immediately. One glass of orange juice has 35 grams of sugar in it. And that's what you give people when their sugar drops too low. You give them a glass of orange juice, a blood sugar level that usually has about 5 grams of sugar floating around in your blood at any one time. Now we'll all of a sudden have 35 grams dumped in there. It makes your sugar level shoot up literally within a minute or so. That's how effective that is in doing so. So again, it's not just that you're vegan, it's what you're consuming as a vegan to do so. So nutritional guidance would be important for you to obtain your objectives, which is lose weight, lower your A1C, and to decrease your blood pressure. So losing weight always helps with your blood pressure, always helps with controlling your diabetes, but does not give you the optimal benefit. So I tell people all the time, weight loss and lifestyle changes are in addition to, not instead of, any prescription drug that you may have. Sometimes people ask, I've had this question today. Second person I saw this morning, I was introduced to the concept, you're going to have to take these prescriptions. Well, how long am I going to have to take them? Am I going to have to take them forever? Yes, and probably, because you're on the, this person was in their late 50s, almost 60, and it's, nothing dramatic is going to change what they've done for the first 50 plus years of their life. So the objective is to slow things down, not allow disease processes to get worse, and not worry about what you're taking. And then a good question actually was asked. Well, what about lowering the doses? Once I get on the medication and I get improvement, can I lower the dose? Well, you could, but why do that? The decision-making point is, am I going to take medication? Am I not going to take medication? If you decide to take a medication, then the dose that you need to take is the dose that works for you. It doesn't matter what the number is. Let's say, for instance, a medication has a 20 milligram dose, a 10 milligram dose, and a 40 milligram dose. If 40 milligrams is what it takes to get you control, nothing changes by going down to 20 milligrams, except you might lose control. The decision is, am I going to take the drug? If you're going to take the drug, then take a dose that works and a dose that works for you. So a therapeutic dose, that's what's important. So titrating a medication down to a less than effective dose is not a good clinical objective. Our objective is to treat the disease state, get it under control, and that may mean staying on a higher dose of certain medications. It may not, it just varies. But a golden objective is not to aspire to cut the dose in half, which was the exact language that was utilized. I want to cut the dose in half. No, you don't. You want to do whatever it takes to keep your symptoms and your disease state under control. Great question, Tamika. Billy Sue, I'm just wondering whether you were going to ask a question. Camera peel and anemia. Can you tell me what the doctors are looking for? The camera peel is an amazing thing because it literally is just that. When a person has anemia and they can't figure out what it is, the first thing they look for is bleeding in the GI tract. One, if you're a woman, you have childbearing age, you have periods, you have menstrual cycles, then that's number one choice by none. You could have fibroids, you could have a variety of different pathologies in your uterus that are causing you to excessively bleed. And a lot of women have that problem. They're bleeding all the time. They have periods that last for weeks and weeks. They bleed heavily when they have a period. Instead of it being for 3 or 4 days, they bleed for 2 weeks. They're going through pads over and over. So that is a simple reason that you would be anemic. If you're not of childbearing age or you're not having periods for whatever reason, your birth control may stop your periods, you're pregnant, some other reason, you just menopausal age, then the GI tract is the next guess. So you get a colonoscopy looking for bleeding from the rectum. You get an upper endoscopy. They stick the tube down your throat. They're looking for ulcers, gastritis of the stomach, where the lining of your stomach is literally just oozing blood. And guess what? You don't see anything. Okay, wow. Now what? So that the part they weren't able to see was the lining of the small intestines. So you swallow this camera peel, and it literally, from the moment you swallow it, it takes pictures all the way through your esophagus, your stomach, your small intestines, your large intestines, and then it comes out when you have a bowel movement. So, but it takes pictures the entire time. And so this is incredible technology that can sometimes see ulcerations inside your intestines. Again, we talked about colitis. Ileitis is when you're infecting the small intestines with that same process. So ileitis, colitis, all of those issues, and it can make that diagnosis. So they're looking for a reason that you're bleeding. And that's a very simple and elegant way to do it. It's not even that big. It's not difficult to swallow. So you won't have any difficulty doing that, but it will answer a lot of questions as far as possible reasons that you are anemic. They may do that test, find nothing. And then you say, okay, just take some vitamins. We know that it's not cancer because anemia in an adult is, can be cancer until proven otherwise. So that's what you're looking for, a bleeding source or a malignancy that's causing you to be anemic. Okay, great question. What is the normal blood sugar for non-diabetics throughout the day when not eating? A normal fasting blood sugar in my training period was less than 120. They lowered it to 100 in my practice lifetime. So now a fasting blood sugar is considered normal if your sugar is less than 100 milligrams per deciliter is the unit of measure, mgs per dLs. For a non-fasting state, that means anytime you've eaten whatever, your blood sugar, anything less than 160 is a normal blood sugar. You can eat something, your blood sugar goes up to 200 or 300, and then it comes right back down. That's kind of a pre-diabetic state. It means you're not effectively metabolizing your sugars and your carbohydrates. So that usually indicates that you are susceptible to the diabetes state, even though you may not technically be diabetic, but your hemoglobin A1C may answer that question. But you go to the doctor. Doctor says, I want you to come in fasting. You get a fasting blood sugar and it's normal. But then I do a hemoglobin A1C and I see it's elevated. That means that postprandially, meaning after you eat, your blood sugar gets out of control. So it's something that we need to do about that to alter your metabolism a little bit, monitor what you're eating, decrease the amount of carbs in your diet, and help you either prolong before the onset of diabetes or prevent the onset of diabetes proper. Okay. Ivritron, is there a cure for protein S deficiency? No, that's a genetic problem and it cannot be cured, but you do support, you give protein supplements. You can help treat the symptoms and the sequela, but we are not capable of fixing genetic defects at this point. Ms. Tiny, what's a good dose of clonidine will curb hot flashes? My doctor prescribed 1 milligram daily at bedtime. Do you recommend this course of therapy? Clonidine would not be my first choice as one of the options, but what I would do is give you bioidentical hormone replacement therapy, or BHRT. If I give you a pellet that replaces the hormones that you have deficits in, the hot flashes will go away in a very short period of time. So the clonidine may give you some benefit and stop you from waking up in the middle of the night, flashing and soaking your bed sheets with sweat. But again, it's a way to do it. It's not, it wouldn't be my first choice, but I have done it. But what I have found that the most effective, bar none, is bioidentical hormone replacement therapy. That is a treatment that I offer in my office. Doctors around the country do it. Google BHRT. B as in boy, H as in Harry, RT, and find out more about how you can help. You get a pellet treatment today, hot flashes are gone almost tomorrow or the next day. So it's amazing therapy, how it benefits women. Every female patient that I've given pellet to absolutely love the fact that that symptom in particular goes away almost immediately. So hot flashes can be controlled. I don't want to say cured. Cured is pushing the envelope a little bit as far as wording and verbiage is concerned. But let's just say symptoms well controlled, then you're just not having to deal with hot flashes. If you're menopausal, if you're menopausal, for men, if you're menopausal, Dr. Collier was suffering from menopausal symptoms, including hot flashes at night. And you wake up and you say, oh my God, this is a problem. Dr. Collier got and received bioidentical hormone replacement therapy, and symptoms resolved. There are 1,000 other benefits to bioidentical hormone replacement therapy. Men, it makes you young again, so to speak. Again, highly endorsed, highly recommended. BHRT. Next question. Ivritron. I have the Immune Pack and I also take 20 milligrams blood thinner daily. Is there any concern? If you have the Immune Pack from the Lipodrops website, if that's what you're talking about, yeah, it doesn't affect the blood thinner. There's nothing in the Immune Pack that will alter the function of the blood thinner. The things you'd have to be concerned are anti-inflammatories like aspirin, NSAIDs, non-steroidal anti-inflammatory drugs like Motrin, Advil, Aleve. Those are products that can alter the function of blood thinner. And vitamin K, which some people combine with vitamin D because it makes it absorb and work better, can alter your blood ability to coagulate. So if you're on a blood thinner and you take vitamin K, you won't stop bleeding if you get cut, or you can even start bleeding internally, or having bleeding ulcers, a variety of different things. But the Immune Pack is compatible with the with 20 milligrams of blood thinner. There are several options that you could be taking. There's Eliquis, there's let me see, one that Eliquis is the most common one I can think of right now. There's Plavix. Plavix is a 75 milligram tablet, so that's not what you're taking. You're taking Xarelto, probably a 20 milligram dose. So Xarelto with an X, Xarelto, Eliquis, and Plavix are the three blood thinners that are most commonly used. The old school blood thinner, Coumadin, is one that you have to monitor your what's called your PTT levels and go to the doctor's office to get that done all the time. Okay, next question. I'm constipated and I'm taking Miralax. Day 4, and I'm only having a little bit of a BM. Stomach is still bloated in the middle. What else do you take? I would just go on and use a laxative that will clear you out. Miralax at the right dose will do that, but it seems like you need a stimulant laxative, like Senna, Senna. That will help. You can, if you really want to blow it out, a bottle of magnesium citrate, which is what you take when you're going to have a colonoscopy. Looks like a bottle of Sprite. You drink half or a whole of that bottle. That will clean you out. It'll be 3 days before you have another bowel movement, because that is the transit time of the gut in the United States of America. Places like Africa, the transit time is less than a day. That's why they live longer, have better, they have flatter stomachs, and don't have the issues that we have, unless they come over to the United States and start eating American foods. Again, you would benefit from probiotics, definitely, because we want to get past today. You're constipated now. That means it's probably a constant problem for you. So take the probiotics. We have a product called Lipo Cleanse that also will help you have normal bowel movements, large, easy to pass on a daily basis. It's not a laxative, so it won't give you uncontrolled explosive diarrhea, but it will make it easy for you to have bowel movement on a regular basis so you do not get constipated. Number one cause of constipation: not drinking enough water and not going to the bathroom when you get the urge to go. That is a key problem, particularly amongst most women, because you don't like to use the bathroom other than the comfort of your own home and toilet. So when you get the urge to go, carry you around some Clorox wipes. You got to go empty that colon when it's telling you it's ready to empty, and you'll be better at that. Okay, this brings to a close this episode of the Your Health is Important Facebook Live broadcast. It has been a plum-pleasing pleasure to hear from each and every one of you. We are so glad that you are here, and we are so glad that you decided to tune in and join us. As always, we are here to answer your healthcare questions, and you know we got to close it out with a little In the Stone by Earth, Wind, and Fire. And remember, we tune in Facebook Live every second and fourth Wednesday at 6:30 p.m. Plan your schedule around it. I plan mine around it so we can give you your healthcare questions. You can go to the website and submit your questions in advance if you like, and we'll try to get to them. But I really like when you participate live. Listen to me on the Ricky Smiley Morning Show on Friday morning. First presentation will be at 6:45 a.m. And remember, on the next broadcast, we're going to talk about this new product to control your diabetes and to help you lose weight. So thank you so much for your participation this evening. Havoc, we appreciate a great production, great questions from each and every one of you. Thank you for tuning in. It is just my plum-pleasing pleasure to serve you and to be your medical ready reference. Thank you once again. This is Dr. M.J. Collier, your medical ready reference, your primary care physician. Thank you and good night.